Hello, my name is Tanya Antley. Today I'm doing my slideshow on Clostridium Perfringens. These are my audience members. What is Clostridium perfringens? It's a spore-forming gram-positive rod-shaped anaerobic bacterium that's usually found in animal and human intestines. Some of the statistics on it, it's one of the most common foodborne illnesses in the United States. Some of the complications are food poisoning and gas gangrene. Food poisoning, it's a buildup of the perfringens bacteria in the body, and the gangrene is bacteria that releases toxins that cause tissue death and release a gas into the body. We'll start with food poisoning. The cause of food poisoning, it caused from cooked food that's contaminated with a bacteria that's usually left out in incorrect temperatures. This allows rapid multiplication of the bacteria. It usually lasts only about 24 hours. Some of the less severe side effects may last 1 to 2 weeks tops. Some of the foods that are common that cause food poisoning, poultry dishes, chicken, meats, soups, sauces, gravy, anything that needs to be, whenever you cook it, needs to be cooked at a certain temperature, or if it's left out, it needs to be left out at a certain temperature. Some of the symptoms, one of the main symptoms is watery diarrhea, nausea, vomiting, or abdominal pain, cramping. How is food poisoning diagnosed? It's diagnosed by a stool culture. It'll show the spore growth. Blood tests will show blood cell counts, or your physician, you just tell him all the symptoms that you're having. As far as treatment, usually there's no treatment that's required. Like I said, it's usually 24 hours and that's it. If treatment is needed, it's usually just for the dehydration, and it's just gaining electrolytes back in your system, fluid. Food poisoning prevention. Some of the things that you can do to prevent food poisoning: wash your hands. Wash your hands with soap and water before and after you touch any raw food and or any other potential unclean surfaces, trash cans, countertops, anything like that. Wash your worktops. Wash it with hot and soapy water before and after preparing your food. Wash your dishcloths frequently. They hold bacteria. You use separate chopping boards for your raw vegetables, meat, bread, anything like that. You don't want to use the same cutting board. Keep your raw meat separate. Keep them separate from fruit, salads, breads. If you have raw pork, you don't want to get it with your raw chicken. Keep that separate as well. You want to store your raw meat on the bottom shelf. Cover it. Put it on the bottom shelf of your refrigerator so it doesn't leak and get on any other food. You also need to make sure that your food is cooked thoroughly. Keep your fridge below 5 degrees Celsius, and that'll prevent any germs from forming, growing. The second complication that I talked about earlier was gas gangrene. The cause of that, it's when toxins cause tissue death and release the gas into your body. This usually occurs due to trauma, when someone has surgical sites or wounds. Duration, it depends on the treatment. It's going to continue to happen until you actually have the area treated. Some of the symptoms, these are more severe. It's pain or swelling in the area around the wound, fever, excessive sweating, increased heart rate, vomiting, yellow skin and eyes, air under the skin, blisters with a foul-smelling discharge. Your skin will go from pale to turning gray, to dark red, to purple, or even black. Diagnosis, it's usually diagnosed with a skin test that checks for the bacteria. Your doctor may order a CBC, and that'll check for your elevated white blood cell counts. X-rays to check for gas, or he or she may even want an MRI. Treatment. The immediate treatment for it is going to be IV antibiotic therapy. There will be surgical debridement of the dead tissue. Basically, any dead tissue is going to be cut away. There may be damaged blood vessel repair that needs to be done, reconstructive surgery, or even skin grafts. Prevention. Basically, all your wounds need to be cleaned thoroughly. Any dead tissue that are around wounds needs to be removed. If you're having abdominal surgery, you need to have IV antibiotics before, during, and after the surgery. In conclusion, Clostridium perfringens, it may continue to remain in the digestive tract without any complications, or it may suddenly rear its ugly head and cause food poisoning or gas gangrene. However, with prompt medical treatment, gas gangrene can be resolved, while food poisoning may not require treatment at all. Food poisoning itself can be avoided by following the motto, when in doubt, throw it out. Thank you for joining my presentation. Have a good day.